Hello all. In this session we can start with the high ceiling diuretics. Furosemide is a prototype of high ceiling diuretic. They are more powerful diuretic compared to other diuretics. They alone can excrete sodium ion up to the 20%. They are known as an high ceiling diuretic because if we can see the dose response curve of high ceiling diuretic, it is a steeper one, and if we can increase the doses, there is a maximum increase in the sodium elimination, and that can be reached even up to the 30 to 40%. That is why they are known as an high ceiling diuretics. Regarding the mechanism of action, they specifically act at a thick ascending limb of loop of Henle, where they can inhibit the sodium potassium to chloride transport pump. This transport pump is basically a neutral pump where two positive ion is reabsorbed and two negative ion is reabsorbed. By using furosemide, it inhibits that transport pump. That means the reabsorption of sodium, potassium, and chloride ion is prevented. So tubular fluid contain this ion more and they are eliminated out. When tubular fluid contain more sodium and potassium ion, that positive pressure which is created to open up the potassium channel, now that is not created. There is a no opening of potassium channel. If potassium channel is not open up, there is a no reabsorption of calcium and magnesium ion. So the reabsorption of calcium and magnesium is also prevented, so they are eliminated out along with the sodium, potassium and chloride ion. It is said that furosemide also having ability to increase elimination of bicarbonate ion, but exact mechanism how it inhibit the bicarbonate ion reabsorption at proximal tubular level, that is still not understood. Additional mechanism which solves with the furosemide is that they can increase the prostaglandin synthesis. We know that the role of prostaglandin is to dilate efferent arterioles. If dilatation of efferent arterioles is there, there is an increased renal blood flow. Additionally, they can also dilate the other vessels, and there is a venodilatation is that both the action increase renal blood flow as well as a venodilator effect is helpful to reduce a ventricular filling pressure in case of congestive heart failure. So furosemide is primary drug to be helpful for treatment of congestive heart failure. Both the action, its diuretic effect as well as the vasodilator effect are helpful. Additionally, furosemide is act at a thick ascending limb of loop of Handley. So that corticomedullary osmotic gradient which is established by using the furosemide, that is abolished. If it is abolished, positive as well as the negative free water clearance is blocked. And when we can say that more sodium and potassium ion is eliminated out from the body, the tubular fluid contain more and more sodium ion. Body feels that there is a deficiency of sodium ion. So when that fluid reach at a collecting tubule, in presence of aldosterone, some amount of sodium is reabsorbed in exchange with the potassium ion. So more amount of potassium ion is eliminated out, and that produce hypokalemic effect with a furosemide. Its pharmacokinetic parameters. Furosemide is highly plasma protein bound drug, so it cannot easily cross the glomerular membrane. To get inside tubular fluid, they are using a specific transport pump. They are secreted to the transport pump which are used by the uric acid. So there is a competition between uric acid and the furosemide for the same transport pump, and due to that they can decrease the elimination of uric acid and they produces a hyperuricemia. It is administered in the dose of 20 to 80 milligram once a day. The onset of action is very quick when it is administered by IV, 2 to 5 minutes, and if it is administered orally, it starts its action within a 20 to 40 minutes. Duration of action is 3 to 6 hours. Another congener is bumetanide. It is 40 times more potent than the furosemide, and due to that more potency, the required dose of bumetanide is quite less than the furosemide, that is 1.5 milligram once a day. Now, important aspect, therapeutic application of high ceiling diuretic. They are the diuretic drug useful in almost all edematous state, whether it is produced by the congestive heart failure, produced due to cirrhosis of liver, or it is produced because of renal diseases. When we can say that if edema is caused by the congestive heart failure, how it is produced? Due to failing heart, there is a gradually decrease in a cardiac output. Due to that, compensatory mechanisms were activated, renin-angiotensin system is activated, and that activation of system can retain more sodium and water. But heart is unable to pump sufficient blood. So there is a gradually accumulation of fluid, and that leads to edematous state. If diuretics were administered, high ceiling diuretic reduced edema by rapid diuresis. So there is a decrease in extracellular fluid volume, as well as they also having ability to synthesize a prostaglandin. Due to that, there is a venodilatation, as well as due to decrease in extracellular fluid volume, there is a reduction in a venous return. So ultimately, left ventricular filling pressure is reduced if furosemide is administered when the person having congestive heart failure. So furosemide is a drug of choice for a congestive heart failure. Other condition, edema associated with the cirrhosis of liver. We know that due to cirrhosis there is a obstruction yeah, against our portal circulation. So gradually there is an increase in a portal blood pressure, as well as diseased liver cannot synthesize a plasma proteins. So gradually plasma proteins are not synthesized. The main function of those plasma protein to maintain colloidal osmotic pressure. Now if plasma proteins are not available, the colloidal osmotic pressure is reduced, and due to that the fluid from the vascular compartment is escaped out and produce edematous state. If high ceiling diuretics were administered, they can reduce a portal blood pressure by vasodilator effect, as well as they can also reduce edema by rapid diuresis. Edema which is associated with the renal diseases. In case of renal diseases, there is a chance to damage the glomerular membrane. So due to that, more and more plasma proteins were eliminated out. When plasma proteins were eliminated out, again, colloidal osmotic pressure is not maintained, it is gradually reduced, and the fluid from the vascular compartment were leaking out, and that causes edema. If high ceiling diuretics were administered, they can reduce the edema. Therapeutic application. They are used for the acute pulmonary edema, which is mainly associated with the left ventricular failure. So by diuretic effect as well as a vasodilator effect, reduce the left ventricular filling pressure, and it can clear the edematous state. Then they are also helpful for the cerebral edema. First drug of choice for the cerebral edema is osmotic diuretic. But in some cases, addition of furosemide with the osmotic diuretic produce more beneficial effect. Then for a treatment of hypertension, if hypertension is associated with the renal condition, or if hypertension specifically in case of emergency condition, if furosemide is administered within a short period of time, blood pressure is under control. For routine prophylaxis of blood hypertension, thiazide diuretics are more preferred, and the furosemide is for emergency condition. Along with the blood transfusion, in case of severe anemia, it is necessary to go for a blood transfusion. And if blood transfusion is done, there is a chance of volume overload. To prevent that volume overload, furosemide is added. And for treatment of hypercalcemia, whenever there is a excessive calcium level is there, to eliminate more calcium ion from the body, high ceiling diuretics were the preferred. So these all are the therapeutic uses of high ceiling diuretics. Adverse drug effect, they can produce hyperuricemia because of competition between a uric acid and a furosemide. So uric acid level is increased, and that produces a hyperuricemia. They can also produce hypercalciuria. Urine become rich in a calcium ion, so they produce hypercalciuria. They also produces a hyperglycemia. So all this effect are the hyper effect. They can also produce hypo effect, decrease magnesium level. They can decrease potassium level, as well as they can also produce ototoxic effect. They can directly damage the inner ear and produce ototoxic effect. So they are contraindicated to be used with the other diuretic which also produce ototoxic effect, like with aminoglycoside antibiotic. They also having ability to produce ototoxic effect. The high ceiling diuretic, we discussed other diuretics in a next session. Thank you.